first week of our shows this year. Jamie Jenkins, former head of health analysis at the Office for National Statistics. Jamie, how are you doing?
Hey, happy New Year, Mike.
Thank you very much indeed for joining us. Well, I suppose you're probably tired of people saying it's not a very happy new year right now because everybody's in lockdown. The conditions and the restrictions seem to be worse than ever. But obviously, what we're being told is that the numbers are rising. The new variant has caused the government to really have no choice but to do this. I mean, maybe we can argue at another time about whether the lockdown will actually work, because I've yet to become convinced of any of them actually working in terms of cutting down on the deaths. But what are you seeing statistically, and what's the picture that you can tell us about?
Yeah, so we are seeing increases in the daily deaths. Now, remember the numbers that are announced each day by the government are the total number of deaths for people who've had a positive COVID-19 test. Now,
Mm.
that is not the same as the number of people who've died specifically because of COVID.
Yeah.
And at this time of the year, we're going into the winter months, and you normally see deaths starting to rise. So I think the best metric, and this has been kind of undisputed since the start of the pandemic, to use is the number of excess deaths. So, Mike, what that is the total number of deaths that you would expect in the country at any one particular week, and how many deaths you've got above that kind of expectation. And we normally take, say, the last 5 years range to try and give us that kind of understanding. So if we just, the problem you've got with around the Christmas period is when you take the ONS data is the best way to looking at the excess deaths. The problem with the Christmas period is when the bank holidays are in there, and you've got different I think there are 2 bank holidays in some of the previous years. So you get difficulty in the number of deaths registered. So what I've had a look at is the number of deaths in the week just before Christmas. And there were about 13,000 deaths across England and Wales. Now, that's for all causes
Right.
in the week just before Christmas. Now, that's about 1,500 above the average we've seen over the last 5 years. Now, in the same week, there were 3,000 deaths where COVID-19 was mentioned on the death certificate. So you can clearly see there that the number of COVID deaths at the moment in this second wave is more than the excess deaths that we're seeing in the country. So what that probably does indicate that when we're seeing these numbers each day, that sadly, some of the people who are in the kind of the COVID death numbers that are announced by the government every day, they sadly would have died anyway. And we know that the flu is much lower this year. In fact, it's quite non-existent at the moment, the flu at the moment in prevalence in society. So some of those people might have died from the flu. So when we see in the headlines of around 1,000 people a day are dying, are being announced with COVID-19 kind of positive tests, remember, they won't all be caused specifically because of COVID. There'll be some people who happen to have tested positive who may have died anyway.
Mm.
But let's
I
not
mean,
underplay
also,
the
is
issue.
it? I mean, I don't think we should underestimate it at all, because no doubt what we would also find is that from before Christmas, it's increased quite rapidly as well, because that's when this kind of second variant has kicked in. But what I would do wonder, and a lot of people would ask me this question, Jamie, is you say, flu doesn't seem to be around much at the moment. Presumably, it's not inconceivable that some of these people who are dying from the flu.
Well, I'm not an expert in all of that, and the tests are coming in, and you probably would pick them up with the flu. The thing is, though, when we've had the kind of the hand space fate, all the kind of the restrictions that are going in, etc., that does mean that the flu virus would be kind of dampened down as well. We know in the
Yes.
southern hemisphere that in Australia and New Zealand the flu was quite low. Remember now, Mike, that I've said like we were 1,500 deaths above average,
Right.
which is lower than the 3,000 deaths were announced in that week. But we do know that's an average. We're above. We had a very bad flu season back in 2017, where in the same week there was 12,500 deaths. So we are above, but we're not significantly massively above in a bad flu season. But this is above what we would
Mm.
expect. So it's quite clear the COVID is causing more deaths than we'd expect. Now, this is deaths just before Christmas, and we have seen this rapid rise over the last 3 or 4 weeks,
Mm.
Mike. So it could be that when we start looking at the January data, things do get acutely worse, but we're nowhere near what we had in March and April. But I think what we've got this time is we've got better treatments. We know more about the virus than we
Mm.
didn't know in March and April, and it's a kind of it's a respiratory disease, Mike. So it's
Yes.
kind of comes as no surprise that COVID's kind of reared its head again through the winter months, and that might have been the case regardless of a new variant. I think what the vaccine offers hope for is that rather than have above average deaths, which are much lower each week than what we saw back in April, rather than them having them continue now for the next 12 weeks all the way to the end of March when we get in towards the spring. Hopefully the vaccine will kind of reduce that for us.
Yes. I mean, I was reading a piece by a consultant the other day in which he was describing how, because of the treatments now and because of the knowledge, I guess, now that the NHS has, they actually are keeping people in hospitals with COVID for slightly longer, perhaps, than they would have done, because back in March and April, they might have lost them, but now they're not. So they're kind of able to keep them alive, I suppose, maybe for longer. And one of the things I've heard said is that the mortuaries in hospitals are empty, but the wards are fuller. So what they're saying is they're treating people for longer, if you like. So I wonder also whether there are any statistics on people going into hospital with COVID or getting tested for COVID in hospital and then leaving and surviving.
Yeah, well, the majority of people do actually come out, thankfully, because there's a lot of people in hospital, and obviously the number of deaths that are occurring across the country, isn't as high as all of that. So there are the positive stories there. I suppose that the thing that's not talked about a bit, which is kind of worrying, is that I've heard on your show and other shows, Mike, that kind of care homes have kind of been in lockdown themselves since March. But about 1 in 4 of the deaths are people who are dying with COVID who are in care homes. So it kind of begs the question, what's going on there? As in, if people are in care homes catching it and hardly anybody's been able to go and visit their kind of loved ones within care homes. Now, we know that around 1 in 3, maybe 1 in 2 people who have COVID have no symptoms. So it could be that some of the care home staff, unwillingly, not knowing themselves, have passed it on within the kind of care homes. And I suppose if we start in doing an inquest as to what's going on here, maybe we should have been doing better and more testing of care home staff to avoid that happening. And another remarkable kind of statistic as well, Mike, is that when you start looking at these hospital admissions, around 1 in 4 people in England and Wales are actually going into hospital for a reason not COVID. They're catching the virus in the hospital, and then some of those are then sadly leading to death, because obviously we know that COVID is more likely to lead to a death for somebody who's more kind of vulnerable. And if you're already in a hospital for whatever reason because you're ill, catching it in there could be the kind of the thing that pushes you off the edge, kind of thing. So I think there's definitely kind of lockdowns and trying to stop the transmission in community will help reduce the number of deaths, but we've still got that care home aspect and people going into hospital and catching it in hospital. That's contributing to the deaths as well. And I would be interested to know, we don't get the numbers, Mike, but I'd be interested to know exactly how many of the 1,000 deaths were announced yesterday were specifically in care homes, or how many of them were people who went into hospital without COVID and died within there, because that will lend us to understand how much of this excess are we seeing could have been avoided.
Yes. And also, I think it's important, Jamie, that if we are going to examine government policy and how they're managing this this disease, it's important to know where people are getting it, because, for example, the hospitality business, which we speak up for on a large number of occasions, has been shown to be something like 4% likely to infect people with COVID. So going into a restaurant which is properly COVID secure, going into a pub which has got all sorts of screens and has got masks wearing people that come to your table and bring you your drinks, none of that, as far as we know statistically, is a place where you will probably catch COVID. However, in a hospital, you're very likely to catch it.
So yeah, it's difficult. You can't really close the hospitals. But if you look back,
no, that's not what I'm suggesting. What I'm saying is that if there is to be another strategy, and we are to try and make something of the economy in addition to the safeguards of trying to stop so many people from dying, then that these are important kind of distinctions.
Yeah, if you go back to Wales, so obviously I live in Wales. I look a lot closer at some of the data in Wales, and they announced on the 4th of December that there was going to be further restrictions on hospitality. They were all going to have to close at 6 and you couldn't sell any alcohol. Now, I tracked then what happened to COVID in the immediate aftermath. When we had a fire break in Wales, and I think England had a lockdown a few weeks later, we saw about 9 days after the kind of the stringent restrictions come in, we started seeing cases coming down. Now, when the new restrictions came in hospitality in Wales, looking at the chart, I didn't see any impact at all on that. And I know some of the health leaders within Wales were actually talking about the fact that some of the increases in COVID patients that they were actually identifying was because with the kind of the pubs and hospitality closed, people were then more likely to mix indoors in a non-COVID secure situation as well. So What we can see in the data, and it does coincide, you can't say one causes specifically the other, but when the secondary schools closed in Wales, we started seeing things fall. When the schools were closed back in in October for half term, cases started to fall. And cases, the second wave really only started around 10 days after. So it could be that there is an association with the schools. And we know ONS do a survey where rather than wait for people to turn up to take tests, they randomly send tests out to people's houses just to kind of test what's the kind of prevalence that we're not finding in the country. And they are picking up more school children now who are testing positive more than adults. So it could be that school children has been kind of seeding in the virus and it's been getting worse. But then you take back to kind of the public messaging. We've been told, obviously, since the start of the pandemic, that from Professor Chris Whitty, that this overwhelming evidence that it's better for children to be in school than not in school. But now, obviously, the schools are closed. So maybe we've got the policy wrong there, where should the testing be more targeted in the schools? And I know they were looking to roll out the tests, but obviously that hasn't happened because they've closed the schools now.
Well, that's the thing. And I mean, there was going to be mass testing in the schools, but then once it was discovered, or at least revealed by the chief medical officer, that it might be that schools were quite responsible for spreading it, you know, I'm not quite sure what the testing would in fact achieve, other than, you know, making sure that lots of people then went home from school if they were indeed open, which they're not.
Yeah, I think, to be frank now, I think where we are in the pandemic, Mike, is all about the vaccine, I think. And we are hopefully going to start seeing this new vaccine roll out a lot quicker. Where I live in Wales, the percentage of the population is being vaccinated is a lot lower than what we've seen in England. It was good to see the Prime Minister kind of set some ambitious targets for England. Hopefully we'll get that in Wales as well as we move forward. Because if we can get the vaccine out, that will mean that, in particular, the vulnerable groups, because we know the majority of people who are going to end up in these sad daily death figures are going to be over the age of 70. I think that.
Well, I was going to ask you if you have any figures on that, because I've got the main points here of the registered deaths as of the 25th, the week of Christmas, as you were referring to earlier. Doesn't at the moment, from what I can see, it's not breaking it down by age, but I don't know whether you've got that.
Yeah, so the majority of people who are dying, Mike, are over the age of 70, and that's been kind of consistent from the start.
When you say majority, what sort of percentage are you talking about?
You're talking kind of over 80% of all the deaths, basically, Mike. You know, the majority, and very few deaths are in the ages of under 50. And the younger you go, it's very difficult. You will see some deaths, but then, you know, you see deaths from all different causes, etc. So I think that the issue, the reasons for, obviously, for the lockdowns is to stop the transmission, but ultimately you cannot die if you don't catch the virus. So maybe, you know, we need a lesson learned that if this rears its head again in the future, will lockdowns be the right policy? We know lockdowns do work in terms of reducing transmission, but maybe those vulnerable groups, there needs to be more stringent measures there, because the one thing that we don't talk enough about, perhaps, when we're having these daily briefings from the government, is obviously every time we have a lockdown, there's the economic fallout of all of that, and the number of people who are losing their jobs because of all of that. I know friends of mine from the aviation industry who've kind of been made redundant because obviously airplanes aren't flying. So,
well, you've also, I think, still,
fallout.
And also legitimately, Jamie, I think you can still ask the question of whether it does reduce the transmission, because it's one of those questions you can never really answer, because until you stop transmission altogether by locking down, then you cannot tell me that it's stopping transmission. But by the same token, because you don't know how much it would spread if you didn't do it, there's literally no way to figure it out.
Yeah, that's always going to be a difficult issue. Now, in Wales and in England, what we saw is that we had the lockdowns or the fire breaks, things went down. And I've said in the past that the virus hasn't gone anywhere. It's like watching a movie and then pressing pause and then coming back and picking it up again. So that's kind of what happens. Now, in Wales, in the north, we've kind of been in a lockdown for a while now in Wales, but what we've been seeing.
I can't remember when you weren't in a lockdown, to be honest.
Well, yeah, I can't remember myself either, Mike. But what we've seen in the north of Wales, the virus is getting quite rampant in the north of Wales now, where these tough restrictions have been in place, but the virus seems to be able to spread even within North Wales that we're seeing, and you can clearly see that in London, it's just kind of getting rampant in there. If you look across London now, most areas of London, about every person who's taken a test, so for every 100 people who are being tested in London, from most of the authorities, over 25 of them are coming back positive, so about 25%. Now, we were worried back in the pandemic and when the World Health Organization was talking about it, the worry was when about 5% of tests were coming back positive. So it is quite rampant. We'd hope now that these restrictions that we've got does reduce it. I very much doubt, though, Mike, if we put the vaccine to one side, that we'll see it come down as fast as we did in April and May time.
Well, no, because
main reason being just because it's not the spring now.
Well, it's the wrong time of year, exactly. It seems to me as well that whenever you have an area which doesn't seem to have that much COVID, it gets it eventually. I mean, for example, back in March and April, when it was mostly in London and the southeast, it wasn't really much in abundance in the northwest of England. You know, later in the year, when it was more or less out of London altogether and people were saying it's gone, you know, we were in no cases whatsoever, I think we had at one point in August and September. Suddenly it moved up to the northwest. And then it started to move up, you know, as the students went back to universities in places like Newcastle, suddenly it grew back up there again. Now it's moved back down south again. It just seems to move around, doesn't it?
Yeah, and we're starting to see actually some hotspot cases around the back end of down towards the end of Cornwall as well, right on the very kind of west of the country. So that might be linked to the fact that we've had the Christmas period and then students may have gone home and taken the virus back down there, or people have left London, etc., before the restrictions came in. But you're right, the kind of the virus isn't going anywhere. I think we know there's other lessons that we need to learn from all of this. I think it was probably a mistake at the very start of all of this, Mike, where we allowed international travel and people to come in. And I know
apparently now they want to test people a year in, practically. I mean, it's ridiculous, isn't it?
Yeah, it just seems a bit bonkers that that's taken such a while. And I know Grant Shapps was talking about we want to try and stop new variants coming in if we're not sure if the vaccine will work with those. But I think that's definitely a mistake. And the other thing, going back to the spread of the virus, now, obviously, we were promised a world-class track and trace system, and obviously I wouldn't even say we've got one out of a Conference League in regards to what we've had with regards to the track and trace system, because it's quite clearly not been that successful.
Well, they seem to have given up on it now as well, don't they?
Well, maybe they have. I think it's still going on, but I think for me, with the track and trace system, if that was working effectively, then you would eradicate the kind of the virus. Now, it may be, Mike, that obviously we're not like the Far East countries where there's probably much tougher sanctions on the population if you don't follow the track and trace things. But and when I've seen kind of videos of people in South Korea in hospitals as well, the PPE over there seems to be far different to what we've got here. So I was calling on Twitter recently. We've got all this money spent on paying for government contracts, and some of them have been linked to friends of ministers, etc. Maybe all we needed at the start of this was to just bring in people from the Far East who can manage pandemics to actually tell us what the hell we need to do.
Listen, that's far too sensible, for heaven's sake, Jamie. Thank you very much indeed. As ever, Jamie Jenkins there, our former head of health analysis at the Office for National Statistics, giving us an overview